Ever wondered how prevalent tumors are in today's world? The reality may surprise you. In our interconnected globe, few things touch every corner of the world quite like health issues do. And one of the most pervasive health challenges we face today is the occurrence of tumors. These unwanted growths have, sadly, become a common part of our global health narrative. Around the world, millions of people are diagnosed with some form of tumor every year. This isn't a problem confined to any one region or demographic. From the bustling metropolises of Asia, across the sweeping plains of Africa, to the most remote corners of the Americas, tumors are a reality we all face. The impact of this is staggering, not just in terms of the toll on human life, but also the social and economic implications. Families are disrupted, careers are put on hold, and the cost of treatment can be a significant burden. But what exactly are tumors? How do they form, and how are they treated? These might seem like complex questions, but they're crucial to our understanding of this invisible enemy. At their most basic, tumors are an abnormal growth of cells. They can occur anywhere in the body, and they come in many different forms. Some are benign, meaning they're not cancerous and don't spread to other parts of the body. Others are malignant, which means they can invade nearby tissues and spread through the bloodstream or lymphatic system to other areas of the body. The treatments for tumors are as varied as their types. From surgery to radiation therapy, chemotherapy to targeted treatments, the options are many. But the key to successful treatment often lies in early detection and understanding the nature of the tumor. The first step to defeating an enemy is understanding them. So, let's delve into the world of tumors, uncovering their origins, learning about their types, discussing their treatments, and exploring the latest breakthroughs in tumor therapy. Our journey together is just beginning. To comprehend how tumors form, we have to get down to the cellular level. Every moment, trillions of microscopic activities are taking place inside our bodies. Our cells, the building blocks of life, are constantly dividing and growing. This process is regulated by what's known as the cell cycle, a series of phases that cells go through to duplicate themselves. However, this isn't a free-for-all. Each cell follows a precise set of instructions. It's like a perfectly choreographed dance where each step matters. In a healthy cell, there are checkpoints in the cell cycle that ensure everything is going according to plan. If something isn't right, the cell can pause the cycle, repair the error, or in some cases, trigger its own death to prevent the error from spreading. But sometimes, these checkpoints fail. The cell's genetic material can become damaged or changed, producing mutations that affect the cell cycle's control mechanisms. When the control systems fail, cells start to divide and grow without stopping. They forget their choreography and start freestyling, if you will. This unchecked growth can lead to an accumulation of extra cells which eventually form a mass or a lump. This is what we call a tumor. Now, not all tumors are harmful. Some, known as benign tumors, can grow quite large but do not spread to other parts of the body. They're like dancers who've forgotten the steps but stay in their own corner of the dance floor. However, others, known as malignant tumors, can invade nearby tissues and spread to other parts of the body. These are the dancers that not only forget the steps, but also invade other dancers' spaces, causing chaos and disruption. So, to sum it up, a tumor is not just a random lump that appears out of nowhere. It's a result of cells that have lost their way, cells that have forgotten how to stop growing, cells that instead of following the choreographed dance of life have chosen their own destructive path. So a tumor is essentially a mass of cells that have forgotten how to stop growing. Not all tumors are created equal. Some are benign, while others are malignant. Let's delve into this a little. A benign tumor is like that quiet, unassuming houseguest who overstays their welcome. They can become a nuisance, sure, but they aren't inherently harmful. These tumors grow slowly and they stay put, not invading the neighboring tissues or spreading to other parts of the body. Most benign tumors are harmless and can often be left untreated. But don't be fooled, sometimes they can cause problems. Depending on their location, they might press on vital organs or block blood vessels, causing discomfort and even pain. They're like the houseguest who, although harmless, starts rearranging your furniture. You might need to intervene if they start to interfere with your daily life. On the other hand, malignant tumors are the uninvited guests who not only overstay but also wreak havoc. They grow rapidly and invade nearby tissues, essentially damaging your home. These are the cancerous tumors, the bad guys in our story. Malignant tumors can also metastasize, meaning they can spread to other parts of the body. They do this by breaking away from the original tumor and entering the bloodstream or lymphatic system. It's as if they're throwing wild parties in your living room, then deciding to take the party to your kitchen, bedroom, and even the basement. The ugly part of this? The damage caused by malignant tumors can be life-threatening. They disrupt normal body functions and can lead to serious health complications. But here's the silver lining. The good, the bad, and the ugly of tumors all come with their own set of treatment options, which we'll explore in the next segment. Understanding the difference between benign and malignant tumors is crucial in determining the appropriate treatment. So remember, not all uninvited guests are the same, and neither are all tumors. Now that we know what we are up against, it's time to discuss the battle plan: tumor treatments. The treatment of tumors is a multifaceted approach involving a combination of different methods. Let's delve into some of the most common ones. First off, we have surgery. This is often the first course of action, especially if the tumor is localized. Surgeons will attempt to remove as much of the tumor as they can, but sometimes it may not be possible to remove it all. In such cases, other treatments are used to target the remaining cells. Next up is radiation therapy. This method uses high-energy particles or waves, such as X-rays, gamma rays, or proton beams, to destroy or damage cancer cells. It's a bit like an assassin, aiming to take out the bad guys while sparing as many of the good guys as possible. The third common method is chemotherapy. This involves using drugs that kill rapidly dividing cells, a key characteristic of most cancer cells. It's a bit like a carpet bombing approach, affecting both cancerous and healthy cells. This is why patients often experience side effects like hair loss and fatigue. Last but not least, we have targeted therapy. This is a relatively new approach that uses drugs or other substances to more precisely identify and attack cancer cells, usually while doing little damage to normal cells. Think of it as a smart bomb, designed to seek out and destroy only the enemy targets. But remember, this isn't a one-size-fits-all situation. The choice of treatment depends on a variety of factors, including the type and stage of the tumor, the patient's overall health, and the potential side effects of the treatment. In some cases, a combination of these treatments is used. For instance, surgery might be used to remove a tumor, followed by chemotherapy to kill any remaining cancer cells. Each treatment option has its own strengths and weaknesses, and the choice often depends on the type and stage of the tumor. In the fight against tumors, two recent advancements have shown great promise: immunotherapy and targeted therapy. Immunotherapy, also known as biological therapy, is a type of treatment that uses the body's own immune system to fight cancer. It's like training your body's natural defenses to become smarter and stronger. Imagine your immune system as a vigilant sentinel, always on guard. Immunotherapy boosts this sentinel, helping it to recognize and attack cancer cells more effectively. Now let's talk about targeted therapy. Unlike traditional treatments that may affect both healthy and cancerous cells, targeted therapy is designed to interfere specifically with cancer cell growth. Think of it as a sniper, meticulously identifying and taking out its targets while sparing the innocent bystanders. These therapies aim to block or turn off chemical signals that tell the cancer cell to grow and divide or cause cancer cells to undergo apoptosis, the process of programmed cell death. But, as with any treatment, there are potential side effects. For immunotherapy, these might include fatigue, fever, or skin reactions. In targeted therapy, side effects may vary depending on the specific drug and could include anything from skin problems to high blood pressure. However, remember that these side effects are often manageable, and the benefits of these treatments can far outweigh the discomforts. Immunotherapy and targeted therapy represent a new era of precision medicine, where treatments are tailored to the individual characteristics of each patient's tumor.
Instead of a one-size-fits-all approach, we're moving towards a future where treatments become more personalized and therefore more effective. These innovative treatments have opened up new avenues in the battle against tumors, offering hope to many. The field of oncology is ever evolving, and with these advances, we're taking significant strides in the right direction, towards a world where cancer is no longer a death sentence, but a condition that we can effectively manage and overcome.
While treatments are vital, prevention and early detection still remain our best weapons against tumors. As we navigate our way through the complexities of tumor treatment, it becomes increasingly clear that the old adage, "Prevention is better than cure," holds a significant weight in our fight against this invisible enemy. So let's delve into the importance of prevention and early detection. Regular screenings are crucial because they can help detect tumors at an early stage. When tumors are small and confined to one area, they're more likely to respond to treatment and less likely to cause serious illness or death. These screenings, including mammograms, colonoscopies, and skin checks, among others, are akin to routine maintenance checks on a car. They might not seem necessary in the moment, but they can be life-saving in the long run. But prevention doesn't stop at screenings. It also involves maintaining a healthy lifestyle. You've probably heard it 1,000 times, but it bears repeating. A balanced diet and regular exercise are essential for overall health and, by extension, tumor prevention. Let's start with diet. Consuming a variety of fruits, vegetables, beans, and whole grains can provide your body with a rich supply of antioxidants, which help protect your cells from damage that can lead to tumor formation. Reducing intake of processed foods, red meats, and alcohol can also play a significant role in reducing your risk. As for exercise, it's not just about losing weight or building muscle. Regular physical activity can improve your body's immune response and hormone levels, both of which can influence tumor growth. Even something as simple as a daily walk can make a difference. And let's not forget about other lifestyle factors like avoiding tobacco and limiting sun exposure, both of which can significantly reduce your risk of developing certain types of tumors. The power to prevent tumors often lies in our hands, and it's a responsibility we all share. Prevention and early detection aren't just individual efforts, they're collective actions that can lead us to a healthier, tumor-free future. So let's take that responsibility seriously, for ourselves and for those we care about. Let's summarize what we've learned today. Our journey began with the unveiling of an invisible enemy, the tumor. We delved into the microscopic world, where cells divide and grow, forming the very fabric of our bodies. But sometimes this process goes awry. A cell's DNA can become damaged, and instead of dying or repairing itself as it should, it continues to divide, creating a mass of abnormal cells. This is the birth of a tumor. We then moved on to categorize tumors into the good, the bad, and the ugly. Not all tumors are harmful. The good ones, called benign tumors, do not invade surrounding tissues or spread to other parts of the body. The bad ones, malignant tumors, invade nearby tissues and can spread or metastasize to other parts of the body through the blood and lymph systems. The ugly ones are the metastatic tumors, which are malignant tumors that have spread to other parts of the body. Our discussion then shifted to the various treatment options available. From surgery to radiation therapy, chemotherapy, and hormone therapy, there are a myriad of ways to combat this enemy. We also highlighted two innovative approaches making waves in the medical field: immunotherapy and targeted therapy. Immunotherapy boosts the body's natural defenses to fight cancer, while targeted therapy targets the changes in cancer cells that help them grow, divide, and spread. But as the old adage goes, prevention is better than cure. We stressed the importance of maintaining a healthy lifestyle, regular screenings, and early detection in preventing the development and progression of tumors. Understanding tumors is the first step in the fight against them. Stay informed, stay healthy,